Gentlemen, let's talk honestly about a subject that's almost never discussed in the open, but is incredibly important for your health after 60. Many men in my clinic quietly admit to feeling that their habits in private may be affecting their overall vitality, prostate comfort, and confidence. But they don't know what's normal, what's helpful, or what might be silently working against them. If you've ever wondered if your approach needs to evolve with your age, this conversation is for you. I'm Dr. Julian Reed, a board-certified urologist. This video is for educational purposes only and does not replace personalized medical advice. We're not here to pass judgment or create shame. We're here to look at this through a purely medical and physiological lens. Today, I'll explain 7 common, overlooked patterns I see in my practice that can affect an older man's urological health, energy, and sense of well-being. First, the crucial context. Your body at 60 plus is different from your body at 40. This isn't a failing, it's biology. The systems involved in sexual function and response, circulation, nerve sensitivity, hormonal balance, and prostate health undergo natural, gradual changes. The pelvic floor muscles, which are essential for healthy urinary and sexual function, can weaken or become imbalanced. Blood flow may not be as robust as it once was. The prostate gland is larger. Recovery times are longer. Nerve signals might be less intense. What this means is that habits or practices that were neutral or even unnoticed in your younger years can now have unintended consequences. They can contribute to issues like increased pelvic tension, urinary hesitancy, reduced sensation, or a feeling of low energy afterward. The goal of this discussion is awareness, not alarm. By understanding how your body has changed, you can adapt your habits to support it, not inadvertently strain it. Here's what most men are never told. Small, intelligent adjustments to your daily and private routines can make a significant difference in how you feel. This isn't about giving anything up. It's about refining your approach to work in harmony with your current physiology. In my clinical experience, when men make these thoughtful shifts, they often report improvements in prostate comfort, urinary flow, overall energy levels, and a greater sense of control and confidence. Your body is designed to function well for a lifetime, but it asks for a more mindful partnership as the years go on. If this perspective of making simple, health-supporting changes resonates with you, please consider liking this video. It helps this important, science-based information reach more men who could benefit from it. Let's go through these 7 common patterns. Think of this as a checklist for optimizing your private habits for better overall health. 1. Ignoring pelvic floor muscle balance. Authority. In my clinical practice, one of the first things I assess with patients reporting urinary or sexual changes is pelvic floor function. Science. The pelvic floor is a group of muscles that act like a hammock, supporting your bladder, bowels, and sexual function. With age, these muscles can become weak or excessively tight and tense. Many men unknowingly clench these muscles during private moments, which can lead to discomfort, urinary issues, and pain. Benefit. Learning to identify and properly engage these muscles may help support better urinary control, prostate comfort, and sexual function. Action. Practice simple Kegel exercises. Clench the muscle you use to stop the flow of urine, hold for 3 seconds, relax for 3. Do 10 reps, 2 to 3 times a day. More importantly, practice fully relaxing this muscle throughout the day, especially during private activity. 2. Using excessive force or pressure. Authority. I often counsel patients that sensation changes with age, and the response should not be to increase force. Science. Diminished sensitivity is common due to circulatory or neurological changes. Compensating with excessive mechanical force can lead to minor tissue injury, desensitization, and can aggravate conditions like prostatitis or hemorrhoids. Benefit. A gentler approach is associated with preserving healthy tissue, reducing irritation, and allowing for more sustainable pleasure. Action. Focus on lighter touch and broader stimulation. Use lubrication generously to reduce friction. Listen to your body. Discomfort is a signal to ease up, not push through. 3. Neglecting the role of lubrication. Authority. I recommend lubricant as a standard part of urological health for older men, privately or with a partner. Science. Natural lubrication decreases with age due to hormonal shifts. Friction from lack of lubrication is a primary cause of minor skin irritation and micro tears, which can lead to discomfort and even increase the risk of inflammation. Benefit. Adequate lubrication supports tissue integrity, reduces friction-related discomfort, and can improve the overall experience. Action: choose a simple, water-based, and fragrance-free lubricant. Make it a non-negotiable part of your routine, applying it liberally at the start and reapplying as needed. Many men your age quietly navigate these changes without a guide. Comment yes below if you're finding this information helpful. 4. Holding your breath or bearing down. Authority: I observe that many men fall into patterns of breath holding, which creates unnecessary internal pressure. Science: holding your breath and bearing down, the Valsalva maneuver, spikes pressure in your abdomen and pelvis. This can strain pelvic floor muscles, impede healthy blood flow, and over time, may contribute to issues like pelvic pain or urinary leakage. Benefit: maintaining steady, deep breathing supports better circulation, reduces internal pressure, and promotes muscle relaxation. Action: consciously focus on keeping your breathing deep and even throughout. If you find yourself holding your breath, gently release it and resume a normal rhythm. 5. Viewing it purely as a physical release. Authority: I encourage patients to understand the powerful mind-body connection, especially as it relates to sexual health. Science: when approached with stress, urgency, or as a mechanical task, it can activate the sympathetic nervous system, fight or flight, which is counterproductive to the relaxation response needed for healthy function. This can lead to frustration and performance anxiety. Benefit: shifting the focus to relaxation and sensation may help reduce anxiety, improve satisfaction, and support healthier neurological pathways. Action: dedicate time when you are not rushed or stressed. Frame it as a time for self-care and relaxation, not just a physical goal. Engage your mind with positive imagery, or simply focus on the physical sensations without judgment. 6. Ignoring post-activity discomfort or changes. Authority: I tell my patients that your body gives you feedback. Pain, significant fatigue, or noticeable changes in urination are signals, not just side effects. Science: discomfort in the perineum, the area between the scrotum and anus, testicular ache, or markedly different urinary flow afterward can indicate prostate inflammation, pelvic muscle strain, or other issues that should be addressed. Benefit: paying attention to these signals supports early awareness of potential issues, allowing for proactive discussion with your doctor. Action: after any private activity, take a mental note. Do you feel okay? Any new pain or urinary symptoms? If you experience consistent discomfort, pain, or blood, it is important to schedule a checkup with your urologist or primary care doctor. 7. Having an all-or-nothing mindset. Authority: in my experience, men often think they must maintain a frequent routine or else they have lost it. This creates pressure. Science: libido and physical capacity naturally ebb and flow with age, stress, and health. Forcing frequency when your body isn't interested can lead to the negative patterns we've discussed. Conversely, complete long-term avoidance may contribute to reduced pelvic blood flow and prostate fluid stagnation. Benefit: a flexible, body-led approach is associated with reduced performance anxiety and more sustainable, pleasurable habits. Action: let your body's interest and energy be your guide, not a calendar or a rigid schedule. There is no correct frequency. The right rhythm is the one that feels comfortable and healthy for you. Now let's build a calm, sustainable plan to integrate this understanding. This is about dignity and long-term wellness. Step 1. Stabilize the foundation. You might think, at my age, do these small habits even matter? In my clinical experience, the men who do best start here. Consistency is your new power tool. Sleep quality. Prioritize 7 to 8 hours of quality sleep. This is when your body repairs tissues and regulates hormones crucial for energy and libido. A regular sleep schedule signals safety to your nervous system. Gentle daily movement. Incorporate 30 minutes of walking most days. This is non-negotiable for pelvic and prostate blood flow. Think of it as irrigation for the entire region. Regular meal timing. Eat balanced meals at consistent times to maintain stable energy. Avoid heavy, late meals that can disrupt sleep and cause lethargy. Small, steady habits build a resilient foundation that makes everything else work better. Step 2. Support the body's systems. This is about working with your body, not fighting it. Hydration habits. Drink water steadily throughout the day. Avoid becoming dehydrated, as concentrated urine can irritate the bladder and prostate. Conversely, don't flood yourself right before bed to avoid sleep disruption. Simple nutrition principles. Focus on adding foods that support circulation and reduce inflammation. Tomatoes, berries, leafy greens, and fatty fish. This isn't a strict diet, but a gradual shift in what's on your plate. Stress management for older men. Find your pressure valve. This could be 10 minutes in the garden listening to music or light stretching. Chronic stress tightens every muscle, including the pelvic floor. Common mistake, trying to correct all 7 mistakes at once. You'll feel overwhelmed. Pick one, for example, focusing on relaxed breathing, and practice just that for 2 weeks. Master it before adding another. Step 3. Build confidence and long-term independence. True health is feeling capable and at ease in your own body. Why confidence affects health? When you feel confident and in control, your body operates from a state of safety, parasympathetic mode, which is optimal for digestion, recovery, and sexual function. Anxiety does the opposite. The role of routine, a predictable daily structure, waking, eating, moving, winding down, reduces low-grade anxiety. Knowing what to expect allows your nervous system to relax. Measuring progress. Don't measure by performance. Measure by how you feel. Do I have less pelvic tension? Is my urination more comfortable? Do I feel more relaxed afterward? These are your meaningful metrics. Reinforce your identity. You are not broken. Your body is wise and responsive. It is communicating with you. Adapting your habits is a sign of self-respect and intelligent partnership with your physiology. Progress at this stage of life is quiet, steady, and deeply meaningful. If you take just these steps and stay consistent, you're giving your body the respect and support it deserves. If this medically informed guidance has provided you with valuable clarity, please support this channel. Like the video. It helps YouTube recommend this educational content to other men seeking honest advice. Subscribe to Dr. Julian. I'm here to be your trusted resource for navigating prostate health, hormonal changes, and maintaining vitality with confidence. Join the conversation below. Your experience helps others. Comment with your age range, e.g., 60s, 70 plus, or type ready if you're committed to applying this mindful approach to your health. Remember, taking a thoughtful, informed approach to your well-being is a cornerstone of strength and independence. You deserve clarity, strength, and confidence at every stage of life. Take care, and I'll see you in the next video.